I'm Alex, the owner and principal chiropractor of Liverpool Chiropractic Clinic, and if you're watching this video, it's because either you're suffering with sciatica or sciatic-like symptoms. And the good news is, we see people with these symptoms every day, and we've got really good at dealing with it. So today we're going to do a presentation and just talk about sciatica. So 3 things we're going to cover today is what true sciatica is and what it's not, where you sit on the severity scale, so you can kind of work out if you have true sciatica or is something else causing your sciatic-like pain. And a couple of strategies you can implement today to take pressure off your lower back and the sciatic nerve and reduce down your discomfort. So what is true sciatica? So the problems become this issue with the term sciatica, in that it's an all-encompassing term we use for pain down the leg. And that doesn't give us an idea of what the true cause of your sciatic pain is, because true sciatica is managed differently to other conditions that cause pain down the leg. For example, piriformis syndrome, you might have lumbar facet irritation, you might have trigger points in the glutes and lower back that can cause pain down the leg, but you're going to deal with those differently to what you would do if we were dealing with true sciatica. So true sciatica is where you get pressure or irritation of the nerve root in your lower back, namely the sciatic nerve, that travels down from your lower back, down your leg and into your foot. And then you get pain that travels across that nerve, and you may get associated symptoms like pins, needles, numbness, weakness, and so forth. There's a few other things that can happen, but that's true sciatica. So it originates in your lower back, travels across of the nerve into your lower extremities. Usually this happens because there's some sort of pressure or force on that nerve root, because it only has so much space it can come out the side here. Or there's been inflammation around that nerve root and it's caused irritation of the sciatic nerve. So if we're looking for top down, this is your central cord, these are your nerve roots coming out either side, this is your spine, and then this is your disc. Okay, so your disc is your shock absorber. Creates space within the spinal joint on the side here to allow that nerve root to come out from the side. Now, this disc, you have your outer cartilage rings, and then you have this material in the center. Some people describe it as a donut. So you've got your donut and you've got your jam in the middle. I would probably describe more like the tire is the outer rings, and then you have like a toothpaste kind of material in the center here that absorbs all the pressure and the shock. So what can happen is, as you have repeated pressure onto the discs, they can start to bulge. So what you find is that they start to bulge out and put pressure on the nerve root. As they start to bulge, you might start getting some tears in the outer cartilage rings. So this starts to bulge out further. And then sometimes this toothpaste comes out and actually causes pressure and irritation on the nerve root. So the disc can bulge, it can have tears, and then it can actually have a full thickness tear where then your toothpaste essentially comes out of the disc and irritates that sciatic nerve. When you have a disc herniation where the toothpaste comes out, that's when you have a whole load of inflammation, and that can be quite severe pain. But usually what we tend to find, because that's a foreign body, your body attacks it and it actually recovers quite quickly. The discs that don't recover as quickly are the small minor bulges, because everything's contained within the disc. They do put pressure onto the nerve and cause some irritation on the nerve, but your body doesn't do anything about it because it's not had this material come out of the protective cartilage ring. I've got my trusty spine, just to show you here. So this is your spine with your natural S-shaped curves, and that's provides your spring, okay? And in between, you've got your shock absorbers, so these are your discs, and then you've got your spinal joints, which create space either side for those nerve roots to come out. Okay, so these nerve roots come out from the central cord, travel to wherever they're going to. In the case of the sciatic nerve, they come out through the bottom, pass through your glute and down your leg. Okay, so now you can see there's only so much space for that nerve to come out. Now what can happen over time is you have wear and tear within that spinal canal, which then means that there's extra bony growth, which puts pressure onto that nerve. You can have disc bulges, which bulge out and press against that nerve. You can have a disc herniation, where actually that toothpaste material comes out and actually presses and irritates that sciatic nerve. You can also have thickening of like the ligaments that help support the spine. They can also put pressure on the nerve. All those causes are what we describe as true sciatica. So there's pressure and irritation of the nerve root in your lower back that causes pain and associated symptoms down your leg. That's what true sciatica is. So you deal with this differently to, for example, if you have piriformis syndrome, which is where the sciatic nerve travels through the piriformis muscle, and the piriformis can either be overactive and tight or underactive and put pressure on the sciatic nerve. There's other causes, for example, the facet joints, so your spinal joints here, become irritated, and they also irritate the nerve, but that's not quite true sciatica because they're a different pain generator. Your sacroiliac joint can also cause pain down your leg, so can trigger points in the glutes and so forth. So there's a number of causes of sciatic pain, but you would deal with those differently to if you had true sciatica. So let's discuss the sciatica severity rating scale. Okay, so there's 5 levels. 1 is mild, so you might have some local pain in your lower back into the glute. You may even have pain down your leg, but doesn't pass the knee. You don't really get any associated symptoms, but you may get some pins and needles, but they're typically around your lower back glute area. They don't go all the way down into your feet. Okay, that's mild. Now that doesn't mean you have true sciatica. Okay. That can be caused by other conditions. So that's why we say it's mild, level 1. So it could be something else, but it could be the start of true sciatica. Level 2 is moderate. So you have intermittent pain, but it does radiate past the knee, and you do get more pins, needles, and numbness in your foot. You have no weakness or numbness, but it may worsen with certain movements, especially sitting for too long in a certain posture. Okay, so that's moderate. So again, that may be the start of true sciatica, but it may be caused by other issues as well. But now you're starting to move along that severity scale. 3 is significant. So you get constant pain down the leg, often into the foot. So now we're starting to think, actually, is this pain that's traveling along the course of that sciatic nerve? This may include numbness, mild muscle weakness, and you will obviously have a bit of pins and needles. Now we're thinking you might have nerve root involvement. So now we're starting to think, actually, this is probably true sciatica or the start of it, and we need to deal with that slightly differently if we were on level 1 or level 2. So level 4 is severe. So this is strong distal pain. What I mean by that is you're going to get quite significant pain in your foot and lower limb. You may even have less pain around the source of the issue around your lower back and glute. You might have more pain further away from the actual nerve root. Constant symptoms, definitely past the knee. You can definitely feel like numbness in your foot. Okay, but you may also get some weakness as well. So you might find that you have a bit of foot drop. So your foot's slapping when you're walking. You may not be able to clear the curb, or when you're going up the stairs, you might catch your foot. You'll definitely have functional limitations, and you might also have obviously the pins and needles, but it's progressed to full-on numbness. So this is severe, and we're starting to think this is definitely nerve root involvement, and we need to treat it like true sciatica. And then level 5 is critical. So you have severe radiculopathy. What this means is that nerve irritation that travels all the way down into the distal extremity, being your foot. Foot drop, loss of reflexes. So obviously we check those in clinic. So you have decreased reflexes. Numbness in your lower limb, especially around the toes and the foot. You may even have bowel and bladder changes. So you might suffer with incontinence. You can't control going to the toilet. That is actually a medical emergency. So you need to go and seek medical help straight away, because that means there's full-on pressure on the nerve in your lower back. These are severe symptoms. This is like level 5. You need to go get help immediately. And this definitely needs to be managed differently from all the other issues that might cause pain down your leg. So just to recap, there's 5 levels, level 1 and 2. This is where you're starting to think maybe the start of true sciatica, but likely there's other causes of this pain down your leg, and the symptoms are more local. Okay, so you don't tend to find them lower down in the lower limb. They're more around your lower back and your glute. Level 3 and 4, now the symptoms are starting to get more severe. You definitely feel it further away from what we'd say was the source. You're starting to think actually there's probably nerve root involvement. So you get your pain in your foot, your numbness. You might even get pins and needles with that, but definitely numbness and maybe weakness in the foot and lower limb. And then you got critical, which is all those symptoms, severe symptoms, but you also have the bowel and bladder changes, which then indicates that this is a medical emergency. You need to seek help straight away. So those are the 5 levels. 3, 4, 5, you're starting to think true sciatica. You're going to manage it like you've got a disc bulge or herniation, whereas 1 and 2, you need to kind of figure out, is there other structures that are causing your pain? So if you're suffering from true sciatica, these are the 3 exercises that I would start with to deal with it, okay? So the first one is sciatic nerve flossing, second one is Mackenzie extensions, and third one is 90-90 breathing with a pelvic tilt, okay? So you're lifting and tilting your pelvis. All these are designed to take pressure off that nerve root, create a bit of space into your lower back, and reduce down your symptoms. So number 1, sciatic nerve flossing. So you're going to sit in a chair. If you've got your sciatic pain on the left side, you're going to do your left side. If you've got sciatic pain on the right side, you're going to do right side. Beth hasn't got sciatica, but we're going to do it on the right side. So what you're going to do, you're just going to extend your leg, point your toes up towards the ceiling. So this is the beginner level, and bring it back down. That's 1 rep, and keep going. So we're going to do 10 of those. And all we're doing is some nerve gliding. So this is the beginner level. Now, when we want to increase this, as Beth brings her leg up, she extends her head backwards. Okay, and as she brings her leg down, you bring your head forward, tucking it, and then repeat. So you're going back and forward. Okay. You keep going for us. So you're going to do 10 repetitions like that. And then if you want to extend it further, so slightly more advanced, you're going to curl your body all the way down into that position. Tuck your chin. Good. And then as you extend your leg, you bring your body back and extend your neck backwards. Okay. And then you repeat. So bring it down, curl over, tuck your chin. And then you repeat going backwards. So that's sciatic nerve flossing, beginner, intermediate, advanced. Start with the beginner, and as long as it doesn't aggravate your sciatic pain, then you can extend a little bit further, work through the levels. Exercise 2 is Mackenzie extension. So the idea behind this is that you're basically going to compress your lower back, and that's going to compress the back part of the disc and try and take the disc away from the nerve. So it's going to try and take a bit of pressure off that nerve and reduce down your sciatic pain. So level 1 beginner might be just lying on your front like this, okay? You're already into a little bit of extension. That might be it. That's all you can tolerate at the time. Now, a couple of things. Sciatic pain would be down in your lower leg. You might not get any discomfort at all in your lower back. This might cause a little bit of discomfort in your lower back, but what we want is less pain in the extremity. And if you end up having more pain centrally, that's fine. It's called centralization. We want that pain to start slowly moving up into your lower back, and we can deal with that there. So you might feel a little bit of discomfort in your lower back, but as long as that pain in your lower legs subsides slightly, you're on the right track. So that's beginner. The second level, you're going to place your hands above your forehead like in a diamond, and you're going to raise yourself up with a diamond press. So Beth, you want to show that? You can extend up. Again, you're going a little bit further. You can tuck your elbows in a little bit. So you're in this position, and you're just going to extend up. So that's level 2. Again, providing a little bit more compression to your lower back. And then level 3, you're going to place your hands, so relax down next to your body. There you go. And you're going to press up into a press-up position as high as you can go. But the idea is you're going to keep your hips down as much as possible. That's quite a large lumbar curve, a lot of compression in your lower back. So that's level 3. Third exercise is the 90-90 hip lift, but this is level 1, okay? So you're just going to lie in 90-90 position, feet up on a chair. You're just going to let your lower back sink into the floor, okay? That might take pressure off of your lower back and just takes out gravity. It's quite a relaxing position, and then you just concentrate on your breathing. In this position, what you can do, we do parasympathetic breathing. So you're going to breathe in through your nose for 4 seconds, out through your mouth for 8, but it's a long, slow exhale. So breathe in through your nose, and then out through your mouth. And you're going to feel your ribs come down. You're going to feel your side arms kick in a little bit, and you're just going to do that for 5 or 6 breaths all the way through, and that's quite a relaxing position. Then the next level is you're going to basically squeeze your glutes. You're going to tuck your pelvis a little bit. So pretend you've got a tail and just tuck it under a little bit. You're going to push your heels into the chair, and you're going to lift off about 1 inch, okay? So as you tuck, again, what we're doing, we're kind of tucking and opening up the space in your lower back to take pressure off the discs in your lower back and the sciatic nerve. Good. And you might do that 5, 6 times, okay? So again, brace, squeeze your glutes, tuck under, lift up, but not too high, just hold it there. And you might do your breath. And once you've done that, you can relax back down then and repeat.